All right, everybody, welcome back to Counter Cause. I'm Evan Kaufmann. Of course, Mark Owens joins me. Brett Edwards joins me. The man, the myth, the legend, Douglas Kaufmann, my dad, is back with us today. Today, we are going to talk about something that I think we should be kind of open and talking about more. That is, depression, life cycles. It's getting a little bit darker earlier, which I know kind of always throws me into, what's it called? SAD, seasonal affective disorder?
Yes,
right?
Good for you. Yeah, SAD. It's also an acronym for Standard American Diet. Many people think, okay, what's the combo there?
That's
the seasonal affective disorder, is it affected by my Standard American
That's
Diet?
the thing, too. They definitely go hand in hand, right? So, yeah, we're going to be talking about that. The topic came up earlier. We were talking about SSRIs, right? Mm-hmm. And kind of what those are. I think a lot of people are on those. I know Mark's mentioned it before. He takes them, and there certainly is a need for it right now. But kind of wanted to break down your thoughts on this and get kind of how it affects us. Is there healthy alternatives that we can use?
You know what, you guys? Sometimes in medicine, we put things on the table and say, let's give it 10 years and see if it works. In the case of SSRIs, which stands for selective serotonin reuptake, a normal, thank you. Mm-hmm. Did anybody hear that? No. A normal physiological pattern in the brain. The I is for inhibition. We stop that cycle from being creative. So drugs block or circumvent or stop a reaction, normal reaction from happening. So along comes Prozac, Zoloft, the SSRI family, and they were good. Depressed people noticed, man, do I feel better. All of that was purported to work on a serotonin level in the brain, a hormone in the brain. We thought that SSRIs increase serotonin levels. And then we realized depression has nothing to do with serotonin. And so on the cover of Psychology magazine a year or two ago, I'll never forget this cover. It said, if not serotonin, what? Why are we depressed? Now, I need to tell you, I go back a few years in this myself. And about 6 or 7 years ago, I put on television a really relevant study that many people wrote me about. It said that antidepressants, specifically SSRIs, have very potent, and I mean some of them were fungicidal, to kill fungus. So they kill fungus in the bloodstream in the body. This huge question, does depression have something to do, the darkness, with fungus that somehow lives in our brainstem or gets in our brain, which it does, and off-gases poisons that are neurotoxic? So it really is deep. You go deep with some of this stuff when you're on my level. But the bottom line is they work. But could we be doing the same thing with, I don't know, monolaurin, neem, some of these natural antifungal supplements like vitamin B3 or D3 that would kill the fungus, and you wouldn't have to be on the serotonin reuptake inhibitor.
Is fungus able, or I guess are mycotoxins able to break the blood-brain barrier?
Oh, fungus is.
Okay.
Just like bacteria, pathogenic microorganisms. Micro means tiny. Organism is germ.
Okay.
So pathogens, those that can cause disease, break the blood-brain barrier. That's what septicemia is. All doctors know about septicemia. When bacteria that's bad breaks through the kidney or the gallbladder and begins circulating in the blood.
Yeah.
And boy, you can die of septicemia. But what doctors don't know, most doctors, is that fungus manifests with the exact same characteristics. You can run a fever, your white count goes up. Everything that looks like a bacterial infection, septicemia, could be fungemia.
This is a really interesting thing. So we should go down that road a bit, I think, too. But fungus can definitely mimic the way other diseases look, right? I mean, it's very hard to distinguish, I think, between a fungal infection and oftentimes cancer, or oftentimes, I mean, a lot of different things, right?
Evan, there's probably 1,000 references on PubMed.org. If you get a grant to do a research paper, you got to put it on PubMed.org. So there's 100,000 papers or more. There's a bunch of references that talk about what we call an aspergilloma. Aspergillus fungus grows in a ball, kind of a white enclosed ball, and on X-ray, you can't tell it from lung cancer. And so many times we jump to the gun And we sit down with the patient and say, I got really bad news for you. I know you don't smoke. I don't know how you got lung cancer, but look, we put up this x-ray and boom, it looks exactly like cancer.
For a lot of people, they don't understand a fungal infection.
Right.
Yep.
Sometimes they do. They're, yeast infections, things like that.
Yeah.
But for the average person out there, watching, and doctor that doesn't understand the fungus connection, how can one go about seeing if they have a fungal infection?
It's a good question.
Test? How do you realize the problem?
Histology is the best way to go, and that's take some and look at it under the microscope. More often than not, blood tests are taken, so you can see antibodies. An antibody is made by a type of white blood cell we have called a B cell. The T cells, are the body's first defense. They stand there waiting for the infection and fight them. B cells make perfect images of those bad germs in your body and then have a characteristic that's really cool. It's called immunorecognition or immunomemory. So the next time that bad guy gets through the T cells, the B cells, alarm off. We've seen this guy before. Absolutely harmless. There are blood tests that can determine. There are urine tests, there are stool tests, there are sputum tests if you suffer from a pulmonary or a lung problem. Give a little sputum to a doctor and he can send it off to a laboratory. The negative is, and you'll see a big problem developing here, the negative is these culture tests, it takes fungus 4, 5, 6 days to grow out. You could be dead. So the doctor is right. If that were bacteria and he didn't put you on an antibiotic, waiting 6 days to grow out the culture.
Yeah, that's a problem, right?
It's a problem. Behind every successful doctor is at least 2 lawyers.
Yeah.
You mean you didn't put her on an antibiotic and she died? Why didn't you put her,
Sure.
standing outside of the box, the standard of care. So there are tests, Mark, but a doctor doesn't have the immediacy of knowing if it's a fungal or a viral infection. And that's why antibiotics are used and currently overused. Brett put up a thing as we opened today's show I thought was so good because it typifies you guys, you're businessmen. Both of you have businesses outside of this podcast. I'm very proud of both of you. Brett put up something, the cost of healthcare in America, $4.5 trillion. You each want your companies to be bigger next year. So does medicine.
Yeah.
We want to go from a 4.5, and that was 2 years ago. We want to go from a 4.5 to a 5.0 trillion. How do you do that? You don't have to change a thing.
Yeah,
we're the sickest nation in the world, right?
Yeah. So in 2022, the U.S. healthcare spending reached $4.5 trillion, which averages $13,493 per person.
Wow. Read that next sentence there.
What's that?
What?
Read the next sentence.
By comparison, the average cost of healthcare per person in other wealthy countries is less than half as much. Wow. I mean, we talked about this with Ganino, right? It's like we spend the most. America spends the most on healthcare and is what, like 32nd
Yeah,
or
we're the
33rd
sickest.
in the. Yeah, it's just it doesn't make sense. It's not a business model that works.
That doesn't sober you.
Yeah, I know.
But you guys, you have to think of this.
Man,
If you're sick, there's 2 things you do, and 99% of Americans do the first. You run to a doctor. As Evan knows, I don't have a doctor.
Yeah.
I have a lot of doctor friends. I don't, a prostate check, what's that? A colonoscopy? That doesn't sound good to me. Yeah. And so I'm just a guy who's made it to 75, without all of that, thank God.
Yeah.
The other 1% will say, why am I sick? I talked about this the other day on television. If I'm a man and I get out of bed in the morning and there's blood all over my sheets, it's probably time to visit a doctor.
Yeah.
It's probably time to get a colonoscopy. It's probably time, maybe too late. That's what the foundation of medicine is based on, is pre-testing, finding out if you have a lump in your breast. Well, it doesn't feel like, but our machines can tell earlier. We don't tell women that those devices are about 58 mammograms, about 58% accurate. PSA, don't even go there with me.
Yeah.
It's not accurate at all. It's highly used. It generates billions of dollars. But I think most urologists honestly would tell you it's a ballparker at best.
Yeah. Let me ask you this. So, like you'd said, if somebody does a chest X-ray and has a lump that is that could potentially be fungus, to where it is a dangerous part to give that 6-day
Right.
evaluation they would need in order to determine if it is fungus. What do you think is the best protocol in that case? I mean, do you start treating with antibiotics, or is that just going to throw fuel on the fire?
If so, as you know, antibiotics, women who are on antibiotics for a long period of time, a lot of them end up with vaginal yeast infections. We know that antibiotics fuel fungal infections, so we have to be careful, but not as careful as saving that person's life.
Yeah.
So often antibiotics are given initially. It's just the way business is done. Evan, the protocol is called a biopsy. Here's the negative. In medical training, we learn a lot about bacterial infections and protozoal infections and viral infections, but nothing about mycology, very little. So your average technician working in a laboratory, I'm not sure they know anything but Candida albicans. I'm not sure they know what rhizopus or phoma or other bacteria look like.
Yeah.
Now, they might go to the pathologist and say, look at this. This is a weird, what is this? Aha, that's fungus. Where'd you get that? Well, from a chest of a 58-year-old guy. Okay, get the doctor on the phone right away. That isn't cancer. That's a fungal infection. And here's the irony. In 2017, the toenail fungus drug diflucan was approved by the FDA to treat cancer. And it really works.
In 2017?
And all it does is kill fungus. And not one doctor says, Evan, is cancer a fungus?
That's what I was going to say. Has there been any discussion in the medical community as to like why they approved that in order to treat cancer? Is there any discussion about that at all? Has anybody said, hey,
You want the answer?
yeah,
Because I've studied this.
yeah.
Now, don't laugh. It seems as though itraconazole or Sporanox, which is the toenail fungus drug that's 30 years old, inhibits the hedgehog pathway through which cancer cells generate energy. Hedge?
Just like way over my head.
Who came up with these words? Hedgehog pathway. To me, I'm sorry, I sit at my desk and just laugh.
Yeah.
Or could it be that the reason the tumor goes down and the tumor markers begin declining, the blood tests, is because they're fungal? That's a fungal. That never, trust me when I tell you, that does not cross their mind.
It's really, really interesting because, I mean, you have been at this for, I mean, gosh, what? How long?
Oh, look at that. That is really good.
In conclusion,
PubMed.
PubMed. Prophylactic.
In conclusion, prophylactic antifungals are necessary during cancer treatment, and fluconazole was shown to be more effective in reducing oral fungal diseases only compared with the subgroup assessing amphotericin B and nystatin administered alone or in combination.
And that's the sentence again, yeah.
Wow.
Necessary during cancer
And that was
treatment.
2023?
But, Mark, that's a bigger process. Do you know you put children who have leukemia? I could go on and on and on about the mold-filled bedrooms of children that have leukemia. You put them on chemotherapy to save their life, and oh, by the by, they go on prophylactic antifungal therapy.
Yeah.
Is the reason children recover from disasterly blood cancers is the reason the antifungals, they put them on prophylactically, or the chemotherapy that everyone knows is such a lifesaver. I don't know.
It was great to read that because, Doug, I've known you since 2010.
Wow.
And, you've battled on the front lines for this. But 2017, 2023, that there's finally studies and articles coming out.
Mark, I feel like it's okay to die now. I feel like after 54 years.
But try not to.
Right, I'm not going to try not to. But I have this pill. A doctor just gave me this pill. No, the bottom line to it is it's been rough for 54 years. You guys, he knows. You can't imagine what I've been through. The ridicule, the laughing, and I let it roll off my back. I let it roll off my back. There was a guy that was shot at a short time ago. I don't know if you guys know about this. He got hit in the ear, and he gets up, and he's raising his arm, going, fight. That's kind of my story. I've had to fight, and here's why. When I read you guys' brochure, a Christ-centered podcast, of course, he'd be involved. Brett, of course.
Yeah.
In the Old Testament, I had to look up what the books of Moses were. In the books of Moses, there are 30 derogatory references to fungus, mildew, leavening. In the books of medicine, derogatory references to viruses, cat scratch fever, bacteria.
It is odd that there's no discussion about fungus.
A little bit Candida vaginal yeast.
Yeah,
You brought it up.
yeah.
Ringworm.
Yeah, but
You
that's
know.
the extent, right?
Yeah,
I mean,
it's not much on it.
until now. But even now, I mean, with those articles, I still think that if you took that info to a doctor and said, "Hey, I think this might be fungal base," they're going to say, "No, you're crazy."
Yeah,
No, it's
and
not.
they do. And
Yeah.
I get to hear this all the time.
I mean, even with all this now. Okay, let's see.
that
what
was
does
a
it
good
say
one. That was
here. The most common
Genera.
of fungi that contribute to the development of versatile cancers are Candida sp.
species.
What's that? Candida species, Aspergillus species, and Fusarium species, causing an inflammation and consequently contributing to the progress of various
Yeah.
cancers.
Isn't that unreal, you guys? By the way,
I mean, it's right there.
Fusarium makes a byproduct, a mycotoxin called zearalenone
Yeah.
that's estrogenic.
Yeah.
You got to be very careful. The FDA has approved dairy cattle putting this on their ear when they're little, and it is absorbed slowly through their body for one reason. It's a growth promoter. It's a hormone.
Yeah.
And in my humble opinion, you follow breast cancer lines. People who want more information on this, go to bcpp.org, bcpp, breastcancerpartners.org, and type in the word Zeranol, Zeranol. If you have young children, your mouth will drop open. As you read about precocious puberty induced by this, wait a minute. We're putting it in our beef, and it's leaking into our milk supply.
There's a big. I've been reading lately. There's a big thing going on with a rise in puberty at such an early age.
Yes.
And we know why, Mark. We're kidding ourselves. I've always said when you've got a company that heads up our food production and our drug sales, you got a problem. You teach people to eat garbage, so they need pills quickly. And the pill companies are paying. These are probably great people. I don't know them, but they're paying millions of dollars to the FDA to get their drugs on the market fast-tracked.
Yep.
So it would seem to me, if I'm the guy, if I'm Doug FDA, if I'm Doug FDA, I'm telling people GMO, pesticides, urban, that's the way to go. Franken foods, eating crickets, this is good.
Yeah.
You know, eating yeast balls, this is good.
Yeah.
Because you're going to get sick, I believe, and you're going to need pills.
What they're selling.
From the very people that pay your salary.
Yeah. Wow.
It's tricky.
Let me ask you this. Is Zeranol, is that something that we should be concerned about in like grass-fed animals, or is this only in like, is there anything in place to keep all of this out of what ends up being a grass-fed animal or finished animal?
Sure. And thank you. That's a huge question. You and Mark just ate a beef stick I had in my office.
Yeah.
The reason I bought that brand, and I went through 20 of them, is it says grass-fed. That doesn't mean much to me. All cows are grass-fed. But then it said free of zearalenone, free of hormones.
Okay.
Yeah, free of antibiotics, free of hormones.
Good to know.
Grass finished is a buzz line. It's like natural.
Yeah.
Grass finished.
Like, what is that really?
I'm sorry, grass fed is a buzz line because all cows eat grass at some time in their life. And then the FDA, the governing bodies, allow them to load up on corn before they slaughter them because those carbs, little did we know, folks, are making us fat too. But those carbs are used to then get the cow really fat before you kill.
Yeah.
So grass finished is what you want. When you go to a restaurant, oh yeah, we got grass-fed meat. Is it grass finished? 100% of the waiters will tell you, I don't know, I'll go ask. 100% of the owners will go, I have no idea. Say yes.
Yeah.
I don't know. I don't know a restaurant, and you know I go into a few of them out here.
Yeah.
I don't know a restaurant who has grass-finished meat, or I would be eating it every day.
You brought up a good point, though, about grass-fed. Like, I wonder what stipulations are in place to call an animal grass-fed. Like, do they have to eat a certain amount of grass and they can eat corn and feed and all that other crap.
Well, I know with the chickens, it's a joke.
Right,
Free
right.
range.
Exactly. That's why
You could have like a 2x4.
Oh, look at that picture.
corn-fed versus grass-fed.
You
Wow.
can see.
Yeah, you can see it
To
for
be
sure.
candid with you, when Ruth and I, Mom and I buy grass-fed, it looks horrible and it's chewy.
Yeah.
But the one on the left up there, top right, the one on the left looks really good to me. That's what I used to eat.
Yeah.
And you're eating Zeranol, which, by the way, along comes a company, a pharmaceutical company, and says this zearalenone is natural. It comes from Fusarium mold. Let us make a synthetic. And it's according to the FDA, it's 3 to 4 times more powerful than zearalenone. And we're putting this now. Having said that, the FDA has said, no, this is not, it's not enough in there to cause any harm. And we're seeing 9-year-olds with pubic hair, and they're telling us this is just normal.
Yeah.
One of the things I think is important to note too about this corn-fed versus this grass-finished cow is that the red color is much deeper, so the blood must have a lot more nutrients in it, right? And it's also, if you look at the difference, the corn-fed cow looks like somebody that's metabolically unhealthy.
If I were a person,
there's a lot of fat around it.
Muscular fat, and it tastes amazing, obviously.
Yeah.
But it's also a metabolically unfit cow.
Hey, Brett, do you know where the mycotoxins end up, like the zearalenone? They all end up in the fat.
Okay.
Remember years ago, the cardiologist told us, well, trim the fat off your steak, which fat is one of my favorite parts.
Right.
Trim it off your steak. Look at the one on the right.
Yeah.
They aren't backing up with they're not making a ton of fat because they're not eating a lot of carbs. They're eating grass the way the good Lord intended. Somebody needs to ask, remember you guys, the prodigal son? I am, by the way. Don't ever tell Mom I told you. I am that prodigal son. I think, to a certain extent, we all are. When he comes home, he's had it. He's broke. He comes home, and Dad steps off the porch, and he doesn't get a slingshot and pop him. He runs out, embraces him, and said, you were lost, and now you're found. And then what came next in the Bible?
Slaughter the fatted calf.
Slaying of the fattest calf.
Yeah. The best
The
one.
best
That's right.
one.
The best one.
He's home. I'm crying. I'm thrilled. Welcome home, son. And the Bible didn't go on to say, his son died of atherosclerosis and the dad was 400 pounds overweight.
Cholesterol was high.
Right. His cholesterol was high. No.
Yeah.
It's just we in medicine, we must first create a problem, right? Then we must tell people that we're responsible for fixing that problem.
Yeah. You're not going to give your clients a solution to not come back and buy again.
I just read an article, you guys, it was so funny. It said how to manage, it was in a medical journal that I get, how to manage your patient's diabetes. Can I cross that word manage and put fix?
Yeah. Right. It's like, why aren't people thinking like that? Why aren't doctors thinking like that?
We're dumbed down, Evan. We're dumbed down.
I mean, there's really no other excuse for it other than that. I think you're right.
But Evan, if money is important, I bet you your bank account doesn't have $4.5 trillion in it.
It doesn't.
Yeah, mine is close, but but it's generating huge amounts of money. A loving mom took me to a loving pediatrician who told me, man, I've got my tonsils are inflamed. I've got to have them out.
Yeah.
Did I? It's an infection. Wouldn't antibiotics have taken them down? The answer is yes. But along then, I was drinking tons of pasteurized milk and eating meat long before zearalenone came along. But before zearalenone, you'll notice restaurants are now saying, no antibiotic free.
Right.
Turns out zearalenone, being the steroid, a hormone, makes the cow grow just as fast. So we're good to our public. We're taking antibiotics out.
That's what exactly. That's the part that I'm a little bit, I think, worried about, is just making sure that you are buying the cleanest stuff. The healthcare industry is worth $808 billion in the United States as of 2021. 65% of the industry's revenue comes from patient care. Wow.
So half $1 trillion a year.
What's the other half from, do you think? Or the other 35%?
Drug intervention, surgical. No, that's patient care. From patient care. What do you think, Brett?
I don't know.
65. Where's the other 35%?
What defines patient care, Brett?
Yeah.
See if you can look that up.
What does that say? 2024 profit forecast. Oh, yeah, no.
Size of the U.S. healthcare industry, market size.
It says the global healthcare industry is worth $12 trillion. Just estimate.
And okay, go. That's
man.
perfect. Thank you. Did we not read right before that half of it was this little country called America?
Mm-hmm. Right.
So the rest of the globe spends what, 8 trillion, and we spend 5? Isn't that nuts? And are we the healthiest people in the world?
Not even close,
Well,
right?
in the previous show, we discussed ingredients that are illegal in other countries that we use in abundance here.
Yeah. Yeah, totally.
Hey, can we talk about something that comes up at every lecture? When I used to go and lecture to, large numbers of people, cancer screenings.
How does that work?
So, pap smear,
Oh, okay.
prostate exam, mammogram, standing naked before a dermatologist and having him look at your moles. Where's you guys hard on that, Brett?
Standing naked.
No.
Having a guy look at your moles? Where's your heart on that?
Curious.
You're not my son.
I was checking the cameras. I totally blanked out.
We're talking about cancer screenings, which is billion-dollar industry, colonoscopies. I had someone yesterday on my live show, Doug, I'm 54 now. My doctor wants to get a colonoscopy. Listen, and you can't, I've done this for half a century. You can't impose your viewpoints on someone else. If your doctor wants you to get a colonoscopy, there's probably a reason for it. Go ahead and do it.
Yeah.
And then the inevitable question is, have you had one?
Yeah.
No. Do you get your prostate checked? No. What would happen if my prostate had problems? Well, it'd be uncomfortable sitting. You'd be up 3 to 5 times a night urinating. You'd have pain. Okay, no. I mean, it's so amazing to me how what does a doctor do? He needs to find something wrong.
Well, that's exactly the problem, right? If you go in and do a test like that and your doctor says, hey, the results came back and it looks a little scary, let's do this. You're probably not going to question it, right? You're just going to say, shoot, scary, I'm out. Okay, fine. When you don't really, I don't think we know the right questions to even ask. I know I don't. Like, I don't know what to ask. Okay, so how much is it elevated? What should, again, symptoms. What do I look for? What should be scaring me with this, right? It's like we're not trained to ask the right questions. Now, it's a good thing that we have people like you on the show that can help us with that. But I think in general, like the idea is if a doctor tells you, hey, we did a test, the results look a little bit bad, we need to, do surgery or this or that, your gut instinct is to kind of go with that. And so, I don't know. It's a scary thing for sure.
Thomas Pynchon, I read this book so many years ago, wrote a book called Gravity's Rainbow. And in the book, there was a question, if they can get you asking the wrong questions, they never have to provide an answer.
Man.
And I think in medicine, Evan, your PSA level, you're a young man. Normal folks, by the way, is 0 to 4 on a PSA. And when you're younger, 2. Your PSA is 6. And I'm really worried about that. I want to do a digital rectal exam. I want to maybe take a biopsy. And you're sitting there, what?
Yeah.
I just thought I'd come in today because I'm getting a checkup.
Right.
And doctors are relying on unreliable tests. Yeah. I think most doctors will tell you that. There are no givens when we're talking about breast. I just said 58% of our mammograms are reliable.
Yeah.
The other 42%, false positive, false negative.
Yeah.
And yet we pretend, we never give the patient that info. If you went in and you learned that the PSA test was 25% accurate, which...
Is that about right?
Well, so the guy that I met when I was in Vietnam in 1970, Dr. Richard Ablin was a young doctor, University of Tucson, Arizona. He discovered the PSA molecule. And he said in his book, it's a wonderful book, something about, just look up Richard Ablin, A-B-L-I-N, Dr. Richard Ablin, and PSA book. It's a red book. It talks about how that PSA test is mutilated and killed unnecessarily so many men. He says that the digital rectal exam for prostate problems is 1% effective. He shelved the test. He said, this isn't prostate specific. By the by, pregnant women have high PSAs. They don't own a prostate. You talk about a rigged test.
Wow.
But if the naming of it is wrong, how accurate can it be? But the FDA said, well, I'll be darned. The PSA test is 300% more reliable than our best screening, a finger. So how accurate did they find the PSA test? 3%.
That is a rabbit hole worth going down.
Yeah.
That's crazy.
I'm telling you guys, just be careful. And here's the deal. Most prostate infections, like most dental infections, treat them with an antibiotic or an antifungal, hopefully.
Yeah.
That's a whole nother sidebar. By the way, the most common fungus that impregnates or gets into the prostate is Candida albicans. Isn't that yeast? Are we passing this back and forth?
Wow. I heard a stat recently from Dr. Peter Attia, who's on YouTube a lot, and he said that just, I think, 90-something% of males in the future are going to die with prostate cancer, not necessarily because of it.
Yeah.
And we've heard that verbiage before with the chimichanga escapade, right?
Yep.
But it's
Is
generating.
it true, you think?
So what is cancer? Medicine has yet to define. It's a rapidly multiplying DNA aberration in our, in our cells, in the nucleus of our cells. That isn't what I want to hear. I don't want you to define for me what diabetes is, beta cells, pancreatic problem. I want you to tell me why. Why are the cells rapidly multiplying? Oh gosh, there's thousands of papers that talk about this. Fungal poisons, not fungus. Fungal poisons, once they're comfortable, fungus likes it warm and wet. Once they're comfortable inside our body, they off-gas poisons, several of which are probable, possible, or known human carcinogens. And they mutate our DNA. Doctors have not a clue. That is not taught during medical training, but you can thank Evan and Mark and Brett for bringing you this information. It's fact, well published.
I mean, it's scary, I remember first learning all about this back in, July of 2010. And you could feel like you're on an island, I mean,
Yeah.
everything that you've been taught, as far as like, hey, if you, get sick, you go to the normal protocol, go see a doctor, get the script,
Yep.
But learning that, hey, educate yourself. You're the other adult in the room.
Yeah.
Could it be this? Do you have to do this? What are my options? Can diet help? Can these supplements help? What is fungus, And then being able, like the journey that Brittany and I and our family has been on, how do you find a doctor that's like-minded?
Yeah. That's a big one.
So I tell people, either we live in a small town, right? Or you live in a big town, but we live in a small town. Go to a little local health food store.
Okay.
Doctors' wives, not the doctor, rarely. Doctors' wives shop there. Why? Because healthy organic food is good for our body. Is that what he's telling his patients? Probably, if his wife's going in there. Get the name from the clerk of a doctor's wife who comes in. Second, pick up the phone, call his office. Hi, I've got this rash all over my arm. It's embarrassing. I think it's psoriasis. They put creams. They've had me on medications whose side effect is cancer or death. I don't want to go down that road. Does your doctor ever treat skin yeast problems? Or number three, compounding pharmacists. There was no city 40 years ago that had a compound. These are people who take a drug and reverse engineer it. They pull the active ingredients, probably herbs. They pull the active ingredients out of it and throw the glues and binders away. Then that drug becomes a fine powder that you stir in with water and take it. Compounding pharmacists know all the doctors that care that much for their patients that they don't want those excipients or binders.
That's great. And then also, too, if y'all have any recommendations as far as integrative doctors and holistic doctors that are like-minded, drop some names in the comments. Maybe there's, Evan and I and Brett can contact them and we can help put them on the platform and spread their word and their clinic out there to help, because like Dr. Canino said in a previous episode, that we're all connected.
Yeah.
We're all in this together. We're doing God's work. Doug, you're doing yours and you've done it for so long, and Evan and I and Brett want to help, and because there's people out there that really need help.
There's a lot of them. Yeah.
One of the negatives to that, I wrote a book before you were born, I think, The Food Sensitivity Diet. And in the back of that book, I put all these doctors who are sending blood to our laboratories to have food allergies done and so forth. And the people would buy my book and go to one of those doctors. It didn't work out at all. He would draw blood, send it off to our laboratory, great for my business, but then he'd recommend things that I still wouldn't recommend. So I love your idea. Get a list, but know the right questions to ask. You want a doctor who can not only erase bacterial infections, what does he know about fungal infections? You'll be categorized. You'll be called a quack.
Oh, yeah.
Asking the questions Mark is asking right now. Does food make a difference? How do I know? I didn't go through nutrition and medical training. Do supplements? Oh, no, supplements are not FDA approved. Okay, are FDA approved drugs saving lives? Look at the ADEs. They used to call them side effects. They now call them ADEs. Isn't that clever? Adverse drug events. It's so clever. The
Events, like it's not a
event, right? It's not about a swollen eye. Right. It's an event. It's just so sad. But you've interviewed a couple of doctors here that I really like, several doctors that I really like, and I'm hoping people can latch. Look, the bottom line is we're all responsible for our own health. Yeah. You're staring right now, right down the pike at an old guy who doesn't have a doctor. One day I may need one. When I wake up and the sheets are covered in blood, one day I may need one. But my plight after taking grandma to the endocrinologist for diabetes, she died of it. Dad to the cardiologist, he lost a leg and a hip to what they called cancer. And I said, man, I don't want to ever get 45, 50 years old because then people start the trips to the doctor. Taking a day off work, got to go to this doctor, this doctor, this doctor today, and tomorrow this doctor and this doctor. Why? Were you built wrong? Or have you taken what was built right and turned it wrong? Are you doing it? We can use our fork and spoon to correctly nutrify ourselves or to begin digging our grave. Now, with a spoon, that'll take 20 years. And the choice is yours.
Man, so well said.
Mic drop.
Yeah. Boom. We're out. Thanks for watching.
That was awesome.
What is there an amount of fungus that the body needs? I mean, is it because it is a symbiotic relationship, right?
Exactly.
So we do need a certain amount of it, right?
Yeah.
Is need the right word, or do we just kind of casually live with it?
I think it's a great word. We all need it. God put us together.
Yeah.
Lizzie has probably a little 3-year-old dear friend of ours, has probably having half a pound of good bacteria and Candida albicans. It's called a commensal relationship. They get along perfectly. They compete for our food supply. Okay? Until there were antibiotics, watch old movies. Until there were antibiotics, nobody was overweight. Antibiotics, we know they cause cows to get fat. How come we're putting all our children? Well, the doctor said we need to. Of course, then they have to go to a bariatrician or take Ozempic, So God put a layer of yeast and a layer of bacteria. We all now know, which we didn't in 1940, we now know that antibiotics are what we call indiscriminate bacteria killers. Oh, they kill the bad guys, which is good. But they're taking down
the good guys.
Tons of good guys. In their absence, you now have yeast turned on, activated. These yeast are, I saw a picture in a German journal one time of yeast poking a hole through the lining of the intestine. They grow tails, hyphae they're called, in their active state, and they can poke a hole through the intestine. Then the yeast goes away and a hole's left there. What is food allergy? We're eating foods, they're leaking through, we're making antibodies. Yep. So
yeast is to blame for a lot of this, isn't it?
Activated. Evan, God did it right. It's what man is doing. And sadly, we have a medical organization that is self-policing.
Yeah.
Because they don't know any better. They're good, 100%. Really. Imagine twice my IQ and being so excited to have spent $250,000 on an education and then realize when you get out, basically, you're a prescription writer.
Right.
And you better darn well do that.
Yeah.
If COVID comes along and you question it, you can't play on our team.
Oh, yeah.
Yeah.
We saw what happened.
Man, the chimichanga.
Dirty chimichanga. Yeah. That's
what
our
is
word
that?
for it. That's our word for
Oh,
the,
the seed.
yeah, yeah,
See.
the seed.
Chimichanga.
Brett got a chimichanga shot. No.
7.
Seven.
Every time they
Correction.
said get your deep fried tortilla boosted.
Went in and got 7.
Oh yeah, what was the thing? They were like handing out like
Oh, yeah, free French
free
fries.
food.
Yeah,
or-
donuts.
Okay, free donuts and French fries.
Yeah, McDonald's or something like that.
Just man, you could not.
You know,
make that up.
can I tell you?
That's a
I
Coen
don't
Brothers
think-
movie.
I don't think those guys.
They probably
I
got
really
chimichanga too.
Oh yeah.
remember we talked about this the other day. They believe this.
No, 100%. I don't think that the problem is the ones writing the prescription. I think the problem is the training and
The boardrooms.
the boardrooms and the companies who are paying for all this and who kind of own all this operation.
And who benefit from it.
Yeah, because I don't think the people who have spent the money, the doctors who learn all this, I don't think they're necessarily in the wrong. I just think they're not asking the right questions. I mean, it's exactly like us, right?
They're not malicious, right?
No, they
They're
are
not malicious.
malicious.
They're not trying to do it.
Thank you, Brett.
They're not trying to do it.
But they're ignorant to some extent.
You, you guys were here. I got to listen in. Thank you for letting me. When you interviewed a doctor not long ago, and the doctor said, I received a letter from the top stating, of course, doctor, we don't know how to successfully treat this, nor do we know its cause. In other words, what they're implanting into the brains of their resocialized students are don't you dare. You know, this has always blown my mind. Don't you dare think you know the cause of this. This is a rogue.
Yep.
You know, it's always blown my mind how 160, 170 IQ is told through 4 years of training, you're not smart enough to know that lymphoma lump on that person's neck, what makes bread rise? Could yeast because you're not smart enough. You don't deal. Don't you ever say cause or cure. You say manage or treat. Mm-hmm. How could they take these really bright kids? I'll tell you, boot camp is an analogy. They took an 18-year-old punk off the street, 100 years ago, and threw us into boot camp. And I got to tell you guys, in a couple of months, we were no hair. We were saluting anything. We'd walk through an airport. A pilot walked by, we'd salute him. So my wife calls it resocializing.
Yeah.
With her psychology.
That's exactly what it is. Yeah.
They resocialize you to you better listen to them and do what you were taught, or you're going to be categorized with a few letters. It starts with Q and ends with K.
Yeah. Well, now even they say he's a conspiracy theorist.
Yeah.
That right there is kind of like the end
Isn't that
goal, right?
just
It's like,
crazy? Isn't
oh,
that
the person's
sad?
just crazy.
Only we are right. Only we know.
Yep.
The silver lining of the chimichanga, though.
I know. Well, and like you mentioned, but they don't know. That's what's funny about it. They say like, hey, these are the rules, but we don't know like why any of this happens, but you got to operate here.
I just don't understand why a lot of them don't push back. They're smart individuals. It's like,
Right.
okay, I'm doing the same
Right.
thing. I'm treating the same thing over and over again. I'm not seeing any good
Yeah.
cures or results for this treatment.
Yeah.
There's got to
They
be
do.
something different here.
I have a organization that I belong to with probably over 100 medical doctors. You have to understand, you get a nice car, you got a vacation home in the hills, you got 2.5 kids, a beautiful wife who's hung with you through all this.
Yeah.
And if you dare step up and question this, whatever it is, this stuff that's falling out of the jets in the sky now, or a rogue virus, you stand to lose all of that. So you better stay in their space. If you guys ever have a chance, read the original Hippocratic Oath. Do you know it says, my teachers, I will honor them as my own brothers and sisters. If their son wants to go to medical school and they can't afford it, I'll pay for it. You don't question what is today the pharmaceutical industry teaching doctors. You don't question that.
Wow.
Yeah. They got all the control they need.
I do want to elaborate on that, where you said that they have the nice cars, they have the nice house. Jordan Peterson is well liked among these circles, but Mr. Anti-Communism himself even got the vaccine and said, okay, we got it. Now, will you just let us live? Right. And so you think to him, if he wasn't making millions of dollars and they were going to take this new fancy lifestyle away from him, would he have gotten the vaccine? I think not.
Probably
and
not.
I think one of the really interesting things about that is when push came to shove, he gave in to everything that he preaches against.
Yep.
And I don't think
I did not know that.
Yes. And so, and he even said in an interview, I got it. Okay, now let me live my life and let me get on with life. And it's like, you have been preaching for years that that's not what totalitarian governments do. That's not what authoritarians do.
Yeah.
And when the action came, the time came, you bent the knee.
Yeah.
Oh, I didn't realize
Yeah.
that happened.
Yeah.
To your own self be true, you know?
Exactly.
I mean, doctors, I just read an article, doctors commonly take huge amounts of money from the pharmaceutical industry to put their patients on a drug. And they did this monitor. They said in the first 12 months, that doctor's prescribing really goes up as long as his checks are coming in.
Yep. Oh, I'm sure.
When the checks stop, the drug didn't work. Then if you guys can perceive this, we're guinea pigs. We're guinea pigs. We don't know what a good and a bad doctor is. We know what a good and bad person is, and usually women have intuitive nature that we guys don't have. Always take your wife, girlfriend, sister to a doctor with you, right? Unless it's a prostate visit. Always take some, female with you and let her meet the doctor.
Yeah.
Because after the exam, she's going to say, let's get out of here. Pay your $180 or $1,280.
Yeah.
And off you go.
Yeah.
Women know this.
Yeah.
They really are good at that.
They're in tune for sure. Man, it kind of leaves you in sort of a scary space, doesn't it? You just don't really know, where to go, who to trust with this. And this is everywhere too. I mean, it's food and drug,
Evan, there are consequences to every decision you and I will make the rest of our lives.
Yeah.
Blood on my sheets. Nah, might have been that ice cream. And 12 months later, or 6 months later, I'm dead of prostate disease.
Yeah.
Bad decision, okay? Blood on my sheets. I better go to a doctor. Doug, you busted a polyp. It's no big deal. But we're going to call it prostate cancer, and we're going to put seeds in your prostate, and we're going to, and you're dead in 6 months. There are consequences to every decision you make. So study issues like you guys. I'm so proud of the three of you. Study issues like you're hearing on Only. I've done 100 podcasts. I've been on thousands of TV shows. You're hearing things here you're not going to hear anywhere else. So like it and tell your friends about this. Park here for the next year. Absorb information that you're here.
Yeah.
We have no vested interest. So, I'm not getting money to be, you bought me
We can
that
talk about
Porsche.
that later. Yeah. Right.
One day.
Yeah. Good
No,
for
I
you.
think that's honestly it. Like, you have to educate yourself. You have to watch, the fringe things that people say, oh, they're conspiracy theorists, they're this and that. But man, you have to look at the other side. You just have to. I mean, we saw this during, chimichanga, like we talked about. We saw all of this happen. And, I think it left a really bad taste in a lot of people's mouth for how these government companies handled this and what requirements were, and people who even spoke out against it. I mean, gosh, these guys were treated terribly with this. So it does give you the sense that, hey, it's probably best to just shut our mouths and live our lives. And you got to push back against that. And that's a scary thing. It's a scary thing as a father. It's a scary thing as business owner. It's a scary thing as a person who's made their life in this industry, right? I mean,
But you have to honor. Remember, they had consequences.
yeah.
They weren't told them. That's where I have a problem.
Yeah, exactly.
Nobody's
Exactly.
told this stuff. 6 years from now, I'll say, oh gosh, the statistics, man, we're sorry.
Well,
Sorry.
remember the video where everybody said, if you get this, you won't get chimichanga. And it was just a clip after clip after clip of, presidents and leaders and all these people saying that. And then all of a sudden, people were getting it. And sure enough, they got this thing. So, yeah, I think you're right, Dad. I think that
Got it a couple times.
Exactly. And I think that we need to kind of expect better out of people who are in charge of this stuff. And we need to demand better out of them. I mean, at the end of the day, that's it, right?
Out of them, but just kind of love your fellow man,
Right.
You're not them. Maybe we decided against it and we were fortunate.
Yeah.
We weren't in the military or somewhere where they mandated it.
Right.
But just honor them. I mean, I have employees, who got several of them.
Yeah.
keep them on payroll, good
of
people.
course.
It's not them, it's the overpower.
Yeah.
Yeah.
It's these people saying, oh gosh, look at this data. Let's not tell them.
Exactly.
Yeah, that's a big thing too. Is forgiving, loving,
Sure.
agreeing to disagree. You know,
Yeah.
it doesn't always have to be.
Yeah. Let a disagreement be a disagreement and be done with it, right?
Yeah, you're not having
Yeah.
to bash or you're not having to anything. You're just,
And Mark,
I choose not to do this. You choose to do that.
Sure.
on that end, we can kind of land this with another biblical reference. Every knee will one day bow. Those who are deceiving us,
Yeah.
Yeah.
they're going to pay for it. Maybe not here, but one day they'll sit at the judgment. Yeek. I'm thinking about that. So will I.
Yeah.
So
No, I know.
Mark. So Mark.
No, I know, man. I think that's exactly it. You take comfort in knowing that, one day the rights will be made. I'm sorry, the wrongs will be made right.
Yeah.
Well, man, Dad, thank you for being on again.
I'd be too proud of you guys.
Thank you.
Giving us all this knowledge.
You're doing such good work. Carry this on.
Yeah.
25 years on television. This is what I've been promoting.
Yeah.
And to have my own son, and his close friends come
I
up
think it's
and
really cool.
and take this over is honorable. Thank you.
Thank you.
Thank you.
All right, well, guys, thank you guys for watching. If you have questions for us, or if you want us to, be in thought and be in prayer about anything that you guys are going through, please feel like you can be transparent and drop a comment in there. And guys, let this community help each other. Like I know Mark has the vision too, Brett does as well, but we really want this to be a community of those who are, praying for people who need it, who are helping in any way that we can. Like Mark had mentioned, if you guys have a doctor who you love, who's really been like-minded in the way of thinking about, treating things from a more holistic place, drop a name in there, drop a link in there. Thank you guys so much for taking the time to watch, and please like and subscribe, and we'll catch you guys on the next one.